Welcome back. You're still watching Kaleidoscope on Channels Television. Let's tell you more about Evercare Hospital Lekki and what the medical firm is doing to bridge the gap in the health sector.
The Evercare Group is a multinational platform formed by internationally renowned organizations with a focus of creating an impact-oriented healthcare ecosystem in growth markets. Evercare is wholly owned by the Evercare Health Fund, a $1 billion emerging market healthcare fund managed by the RISE Fund, the impact investment platform of global alternative asset manager TPG. Evercare's mission is to provide patients in growth markets with high-quality, accessible, safe private healthcare, leveraging an advanced technology and strict adherence to high standards of care and patient safety. As an integrated healthcare delivery platform, the Evercare Group operates in growth markets across Africa and South Asia, including India, Pakistan, Bangladesh, Kenya, and Nigeria. With a vision to be the most trusted healthcare partner and preferred destination in Nigeria and in the West African region, and a mission to enable communities thrive by providing patient-focused care, Evercare Hospital Lekki is determined to provide clinical excellence and outstanding clinical outcomes.
I had a chat with the Chief Medical Officer of Evercare Hospital Lekki, Dr. Ayola Shunibare. Take a look. What inspired the creation of Evercare Hospital Lekki?
Healthcare is a human right, good quality healthcare, and the investors actually felt that something needed to be done about this in trying to transform healthcare and provide a very high quality, accessible, value-based healthcare, patient-centric healthcare. So this Evercare is part of a global chain. There's investment in Pakistan, Kenya, India, and Bangladesh. So Nigeria also happens to be one of the countries that actually benefited from that investment. It's an impact investment. So as well as expecting some return, there's also expectation of making a positive impact, positive social and environmental impact to society.
Healthcare system in Nigeria comes with loads of challenges, but according to your mission and your vision, your aim is to transform the health system in the country. What would you be doing differently?
Well, there are a lot of things that we're going to do differently. There's going to be a lot of emphasis on patient-centric care, where basically patients look for three things. They look for positive emotional experience, they look for positive physical experience, and then they look for outstanding clinical outcomes. We've actually got the largest critical care beds in private practice. We've got about 52 critical care beds out of 165 beds, and we also have the subspecialties. We've got right now about 30 specialists under the same roof, and the benefit of that is that you can receive high-level advanced care. You can get the specialists that you need at the click of a finger.
And talking about your aim to improve healthcare system in Nigeria, you must have a passion also for corporate social responsibility initiatives to help those in need.
Yes, certainly. I think if you come to a community, you need to engage the community. So we focused on that. We did free screening, and this was a program spread around Lagos State. We ended up doing about 66,000 screening, and out of that, we discovered about 30% with high blood pressure and about 2% with diabetes. So these were just random tests with various communities. And we then did counseling, and we were able to refer them for treatment. There's a Lekki Motherless Babies Home that we supplied with foods, other commodities, and we also engaged them that once hospital opens, they're able to bring those babies for emergencies. And we're also engaging with the Lekki community. So there are programs in the pipeline that we intend, so wellness programs for the people that live around.
Do you work with other organizations to help carry out some of these initiatives or your objectives while doing business?
Yes, certainly. So as I mentioned, cardiac sciences is one of our areas that we want to develop as a center of excellence. So we're talking with a particular organization right now, and the idea behind this is what they do. They use technology, they deploy ECG machines, which more or less takes a rhythm of your heart and can detect problems early. So they are planning to deploy machines to primary centers, GP practices. So the idea behind this is that we will partner with them once they pick up that there's a patient who's got a heart problem. They refer to us. We're able to do more advanced investigations and intervention. We're also engaging Nigerian groups in diaspora because, as you know, Nigeria, we've lost a lot of talent to the Western world. So we're looking at programs where we want to reverse the brain drain, convert that to brain gain.
And talking about talent, do you source for them locally or you outsource to join you as professionals in your organization?
Well, basically we do both. In terms of clinical talent, largely local, but there's also a mix of expert talent, because the thing is, in Nigeria, sadly, 85,000 doctors are registered in our medical council. About 35 to 40,000 of those are actually outside Nigeria.
We've talked about health professionals studying here in Nigeria, then leaving for what they term the greener pasture abroad. What do you think the problem is here, and do you think it even has any solution?
If you look at the economics, the Nigerian clinicians in the US, they earn from $250,000 to $1 million a year. In Nigeria, there's absolutely, we're far, far, far away from those kind of figures. If you look at UK, the clinicians, consultants, they earn $75,000, £75,000 to £150,000. So most individuals, they want better life, better quality of life, to be able to provide for their families. So that's one factor. The other factor is being able to have all the things you need to practice advanced medicine. We're providing a lot of that. Right now, healthcare, about 3% of GDP on healthcare. It should be 10 to 15%. So this is another industry sector that is not even moving close to other sectors. It's nowhere close to oil and gas, banking. So until we improve health insurance and the sector begins to enjoy considerable, significant quantum of investment before that changes.
And does your organization allow enough representation of women?
Oh, absolutely. I mean, we certainly have over 50% of our workforce. You need to empower women. That's something that I think a lot of organizations need to realize. But we have a large focus on that, and over 50% of our employees are actually women.
What role should the government be playing in terms of budget and policies to improve the healthcare system in the country?
Regulatory authorities and government needs to jump in and regulate and restructure the entire insurance, and it should also be mandatory. Everybody should have health insurance, and they need to push this aggressively, similar to what has been done with pension funds. Now that we have trillions sitting down, it's similar thing they need to really push. That's on the one hand. Now, additionally, government will need to look at tax incentives and tax breaks for investors to come in. This has been done in other markets. It was done in India, I mean, 40 years ago. So they need to give tax incentives so that duty, people are not paying. Surprisingly, medical equipment attracts the same duty as a chandelier. I mean, that's just, I think it's something like 10, 15%. It's not, no one is going to come to invest here if they don't jump in very, very quickly. And this is a crisis.
Medical tourism is one big issue in Nigeria. How does Evercare intend to tackle this? And what are your plans for your business going forward?
What we're trying to do, again, if you look at our tariffs, we're discounted compared to our competitors. So when people see this Evercare and they think, oh, in the middle of Lekki, middle class is going to be expensive, but it's actually not. So it's very good value. So we're beginning to see that, yes, that will attract a good volume of patients and to get that, the quality care. So that's only one aspect. The other aspect, which is a challenge, is human capital resource. So we're a lot of emphasis on training, and what we're trying to do is continue to train, retrain, and also get consultants from the diaspora and expert consultants to come in. With regards to affordability, we've partnered with a number of health insurance, and this will also help the insurance companies to ramp up. Basically, with regards corporate social responsibility, when we opened, we had a number of critically ill cases that came into our emergency room. People that just came from the streets. But we treated these people. So we're thinking now to set up a foundation, which we're going to call Evercare Foundation. So Evercare Foundation, working with other corporate organizations, will then be the umbrella that will provide for people that will land on our doorsteps that will not have any money to pay. We're also talking to government institutions to help upskill their students. So that's going to be something that we're going to engage whilst they're learning. There's nurses and also doctors. We help to improve the curriculum. They will spend time with us. Of course, they're not going to pay, but they will spend time with us, and we can then upgrade the skills. They will learn new skills from us, and then they will be fit for market by the time they graduate. So that's another thing that is in the pipeline.
And that's it on Kaleidoscope for today. Thank you so much for watching. Don't forget, keep up with all our past editions by going to youtube.com/channels web, click on playlist, and you'll find Kaleidoscope there. Please watch as many editions as you can. Get back to us. We want your feedback. Thank you so much for watching today's edition. I'll see you again. Stay safe. I'm Anne Nwawadu.